When I was ready, you people were not ready. When you are ready to, I got something to cop up. Sorry, forgive me for that, but let's continue. I've seen your messages, but please, it's not intentional, okay? Yeah, I've seen your messages in there, but it's not intentional. I mean, it's not like actually, I was actually ready by 12, but you people were not ready. Then I got a call from my medical superintendent, and we had to discuss something very important. That was why. So you realize that I was just showing the slide like that, but I'm actually here, but I was on a phone call. So sorry about that. Shall we continue? Yeah. So like last time, we were talking about fluids. We were talking about fluids. So I made you know that in the body there are fluids in the body, and for which you as a biochemist, you're going to please can you see the slide?
Yes,
Yes,
please.
For which
please.
you as a biochemist, you are going to how do you call it? As your use this fluids as your sample. So we have the uh, these are the fluids. Sorry. So we talked about where is it? Yes. So we talked about blood plasma, bile, interstitial fluid, cerebrospinal fluid, plasma. So these are the things that we talked about, and these are going to be the samples that are going to be taken forward for these labs to be done. So we are going to take them one after the other and go about them. The commonest one of them is the blood. Okay, the commonest one of them is the blood. So urine waste products secreted from the kidneys, interstitial fluid that are located in between the cells. So this is interstitial fluid. This is interstitial fluid. Can you see it? You see two cells. The cells are, oh my goodness, light out. So that is interstitial fluids. So you see the blue part are interstitial fluids. You understand? When you say interstitial, then inside the blood vessel become what? Intra this one. You see the cell. The cell is the yellow and the purple something. Can you see the picture? Outside the cell, in between the cells are the interstitial fluids. Now we have the intracellular fluid. That one is inside the cell. Then we have the blood plasma. That is the ones, how do you call it? The one inside the tube there. And inside the blood, we have other blood cells, the red blood cells, the white blood cells, the leukocyte, the basophils, the enophils, eosinophils. We are going to, I mean, talk about them, but maybe in our subsequent classes. So let's look at cerebrospinal fluid, CSF. You say cerebrospinal fluid. This is a picture of it. When we talk about cerebrospinal fluid, we are talking about the fluid. We are talking about the fluid that surrounds the brain. It is that fluid that helps to reduce. It serves as how do you call it? Reduce tension, so that it's The what are the what? Are the brain cells or the brain muscles. Then around the CSF is the cerebrospinal fluid. Show you a picture of that. The brain and the spinal cord. Okay, I'll send a picture into the group so that you appreciate it. Let's go. We are far behind time. Protects the brain within the skull and the spinal cord against any impact to the central nervous system. So when there is any impact, when there is any pressure, when there is any trauma, for instance, there's an accident, there is from a height. You understand? The CSF does serves some protective barrier to the brain. But then when it's so massive, because sometimes there can be a serious, how do you call it, accident, a serious crash. It's a massive one. So for that one there, it overwhelms the brain. It overwhelms the CSF and it can cause a problem. But then those normal ones that maybe you hit your head somewhere, maybe somebody punch you, I mean, any trauma to the head, the CSF is serving as a protective barrier. Circulates chemicals and also transfers nutrients. It's serving as more like chemical chemical transport. Let me put it that way. It says circulates chemicals and nutrients that are filtered from the blood. So you realize that the blood streams are there, the vessels are there. So the vessels, how do you call it, transports the nutrients from the blood. You see, the blood carries all nutrients to all parts of the body. What happened is that the CSF is there to serve as a means by which the blood nutrients gets to the brain cells. So when it gets here, the blood vessels assimilates and eject their nutrients, oxygen, protein, glucose, all the chemicals, how do you call it, electrolytes are all ejected into the what? Into the CSF, the cerebrospinal fluid. That is why when there's a problem with the brain, we don't go and take blood sample. You understand? We take what? Cerebrospinal fluid because everything that is more like the blood in the brain, even though there are blood vessels in the brain, but then the blood vessels assimilate into the cerebrospinal fluid. So that is why, and we are saying that the cerebrospinal fluid comes down from the brain into the what? Into the spinal cord. Let me give you a picture so that do you understand what I'm saying? Hello.
Yes, sir. Oh,
Yes, sir, we are following.
Let's continue. I'll give you a picture of it. Yeah. So it removes waste products and harmful metabolites from the brain. So you see, ideally the blood should be the one to be doing that. But then the CSF is what does that. So it serves as the blood, serves as the the uh, the tissue. It serves as a tissue whereby how do you call it? All chemical reactions, all metabolic reactions, anything at all that goes into the brain occurs in the CSF. So we take, if you want a sample from the brain, we do what? We do a lumbar puncture to take the what? To take the cerebrospinal fluid. You need to know about this because if you get a case and they talk about CSF, you don't know what CSF is, cerebrospinal fluid. You want to know whatever happened in the brain. So you don't go and take blood sample to know what is happening in the brain. Because at the blood brain barrier, the nutrients, the protein, the glucose, the electrolytes, everything assimilates. And so now the cerebrospinal fluid is the one now feeding the brain. Do you understand? Give me one second. Let me show you the picture. If you have any question, you can jot it down. Yeah, then we discuss it. So you see, this is the what? This is the central nervous system. So it's made up of what? Look at this one. It's made up of what? The brain and the spinal cord. So the spinal cord evaginates down from the what? Down from the brain. You understand? Yeah. So if you want to find if you want to look for any problem, any electrolyte imbalance, any problem in the brain, you don't go and take blood sample. You understand? You take what? Cerebrospinal fluid from the what? From the spinal cord. And normally it's taken from the what? From the lumbar region. So let me search for lumbar puncture. So you see, normally this is how it's done. Whenever you want to, so this is what the biochemists do. And this is sometimes even clinicians do it. But I don't know, you as a naturopathist, I'm not sure it is part of your job description. But then mostly doctors do, anesthesia, and anesthesiologists, they do that. And this is the same place where whenever they are going to do a surgery, this is where we do what? This is where we give the anesthesia. Our women can testify to this, right? Our women, those of us who have had CS. Yes, Lady Zuzu has had CS, so he's testifying to that. Yeah, Madam Vivian. So you bend down like that, then they inject the anesthesia into the what? Into the lumbar region. When it's injected here, it travels through the central nervous system. So you realize that the whole body, how do you call it? So we have the localized one, and we have the general anesthesia, and they are all done in the lumbar region. It depends on which drug they are giving. Either they are giving the local or they are giving the general. But even now with CS, they do local, right? Anna Vivian, were you giving local or you were giving general? You were seeing as they were doing it, right? But you couldn't hear the pain. You couldn't feel the pain, right? Madam Vivian, can you give us an experience of that? Can you give us your experience? Can you give us your experience?
Yes, please. And please, why is it that mine was like electric shock? When they injected me, it was like electric shock.
So that is the lumbar puncture for you. So whenever so this is where we take the cerebrospinal fluid. So you see the procedure. Can you see this one? This very one. So you see, that is the syringe they've injected into the what? Into the lumbar region. So they are in between. So we have lumbar 1, lumbar 2, lumbar 3, lumbar 4, lumbar 5. So he has gone in between lumbar what? So that is the cerebrospinal fluid that they are taking. They put it there. If you insert a needle and it's flowing like that, you understand? You insert a needle and it's flowing like that. So that is how the sample for cerebrospinal fluid is being taken. Yeah, we can go back to our slide. Is there any question? Is there any question? So that is the central nervous system, the brain and the spinal cord. So they make the patient lie down, bend that way, then they insert the what? The cannula into the what? Into the lumbar region to take the what? To take the cerebrospinal fluid. Okay. So CF biochemistry tests are requested by doctors when the patient is having symptoms involving the central nerve. Oh, can you see? Let me increase the size. Oh, sorry. How do I increase the size? Can you see? All right. So, for instance, several severe headache, difficult with speech, seizure, etc. Mainly two analytes will be analyzed by the laboratory technician, which are protein and glucose. So normally for the CSF reports, we are looking out for two major what? Two major components: the protein and the glucose level. Why? Because when the protein level is high or low, it is suggesting something. When the glucose level is high or low, it's suggesting something. So mostly lab technicians or the medical laboratory scientists, they look out for the glucose level and the protein level. So elevated protein value, as protein is a large molecule, this molecule does not easily cross the blood-brain barrier. When we say blood-brain barrier, now we are saying that I made you know that the blood assimilates into the cerebrospinal fluid. Do you understand? So that junction, there is a semi-permeable junction or semi-permeable membrane there that is preventing some components from entering the brain. Because let's look at this. If the organisms that we found in our cell, we found in the GIT, are able to find themselves in the blood, if there's no barrier then it would be very easy for you to have brain problems. So the brain has a strong barrier that is preventing any foreign organism from entering, except those that are what? That are very good for the brain, like the protein, the glucose, and all those ones. You understand? Some electrolytes that are needed, nutrients that are needed, yes, minerals that are needed, but so that other toxins, other microorganisms that are not needed can be what? Can be rubbed off. Do you understand? So the blood-brain barrier is like a junction. It's like heaven's gates at the brain at the brain level, so that no organism can what? Can just enter. For instance, let's say we have the organism that causes typhoid. If, for instance, there is no strong blood-brain barrier, typhoid can travel to the brain. You understand? This Salmonella typhi, they can travel to the brain. You understand? And all other organisms can travel to the brain, because if they find themselves in the bloodstream, the chances of them moving to the brain is very high. But then the brain has what? A strong barrier that prevents these things from what? From just entering the brain. You understand? So they're saying that as protein is a large molecule, this molecule does not easily cross the blood-brain barrier. Therefore, when CSF, so you see it does not easily cross. So when CSF, so it means that a portion or an amount has to cross. You understand? It has a threshold that I have to cross. So when CSF protein is elevated, this suggests that the blood-brain barrier is damaged and patients might suffer from meningitis. So ideally, protein is a very large compound. It's a very large, how do you call it? It's a very large You understand? It's a very large molecule. So ideally, protein shouldn't cross the blood-brain barrier. So if we start seeing protein there, then it means that there's a problem there. So this suggests that the blood-brain barrier is damaged, and patients might suffer from what? Meningitis, hemorrhage, that's excessive bleeding, or multiple sclerosis. So if you see conditions like this, I mean, when you see protein there, it is telling you that there are some likely conditions like meningitis, hemorrhage, there's excessive bleeding in the brain, or there's multiple sclerosis. And it gives you an idea that these things are occurring. So watch out. 2, reduced protein value. When there is a reduced protein value, fluid is leaking from the CNS. That is what it means. It means that there's a what? There's fluid leaking away from the CNS. The next one is cerebrospinal glucose. That's the next. That is the next. The next topic. So there are two things here. Whenever you are seeing a large molecule like protein elevated, so as I'm saying, there should be what? There should be a threshold. There should be a range. It should be within this range. So if it's high, it means there's what? Meningitis, hemorrhage, or multiple sclerosis. And if it's very low, too, it means that what? There is fluid leaking from the what? From the CNS. Maybe it can be that there is a break in tissue that is causing fluid, cerebrospinal fluid to leak away, and so the protein are what? Also sipping out of the CSF. Then we talk about the glucose. Normal glucose value for CSF is typically 2/3 of your blood glucose. So we are saying that the glucose that you take in, the brain uses about 2/3 of it. The glucose in the blood. So that is why when you are hungry, then you are feeling dizzy. Your brain is not working very well. Because if your sugar is, let's say your sugar is 4, the brain is using like what? Like 2/3 of that. You understand? The brain is using like 2.5, 2.5. So the body cells are all weak. So you become weak. That is why when your sugar is down, you become very weak. Muscles get weaker. Your brain is even getting weaker. Your brain is even getting you are getting the blurry visions here and there. You understand? So elevated glucose value as a result of what? Plasma elevation. So when there is elevated sugars in the plasma, it will elevate that of the what? That of the blood glucose. Then low glucose value, indication of bacteria. So when there is when they check the CSF, realize that the glucose is down, it gives us an idea that what there is what? A bacteria or a viral infection. You understand? There's a bacteria. Why? Because there is a bacteria who is what? Chopping the glucose. The glucose is going down. Not because you have not eaten, but then we check and there's low glucose value. Even normal RBS or normal blood glucose levels. Do you understand? So CSF glucose is usually reduced when foreign cells such as bacterial or elevation of white cells, mainly neutrophils, consume glucose. The diagnosis would favor bacterial meningitis. Likewise, if the glucose value is normal, but WBC is elevated, mainly monocytes and lymphocytes, the patient is suspected having viral or parasitic infection. So this is more like you doing the CSF and realizing that the glucose is low. You have to do a full blood count to also what? Correlate with. You realize that they say CSF glucose is usually reduced when foreign cells such as bacterial or elevation of white cells, mainly neutrophils, consume glucose. So you realize when you do that, so you have to do it in combination with the full blood count. And you realize that the full blood count, your glucose level is high. Sorry, your BBC levels is high. The WBC is the white blood cell count. When we say the white blood cells, the white blood cells are more like the soldiers of the body. So they are always high in a full blood count when there's what? A bacterial infection. Why? Because when there's a bacterial infection, it's just like this. The reason why white cells are high whenever there's a bacterial infection is that whenever there's an infection in the body sees it as what? The body sees it as what? As a foreign organism. And so the body calls its soldiers. And the soldiers of the body are the white cell count. Those are the neutrophils, the eosinophils, the monocytes and those ones. So these soldiers come and they come to fight. They are the white cells. So that is why we see them plenty, because there's a bacterial infection. So the body calls them plenty. And even immature ones like the monocytes, the basophils, they all come in just to come and fight the infection. So when you do a full blood count, you see them to be very high. I think I will have to add a full blood count to this one. I didn't add this one. Maybe on our next slide, I'll add it. So because the full blood count, that is what you take to know the blood. That one you take the blood sample to check. Yeah. So likewise, if the CSF glucose value is normal, but the WBC is elevated, mainly monocytes and lymphocytes, the patient is having viral. So when you have monocytes and lymphocytes high in a full blood count, we are saying there's what? Likely a viral, fungal, or parasitic infection. So please, I would treat full blood count as a whole topic for you guys to know, because you are going to be requesting it. Those of us who have our facilities, do you request full blood counts? Those of us who have our facilities, do you request?
Yeah, sometimes.
Sometimes.
When the need come. Sometimes.
Hello.
Yes, please. Sometimes.
Hello.
Hi. Please, sometimes we request. We ask them to do the full blood count.
Do you ask them to do full blood count?
Yes, please.
Oh, okay. Okay. And are you able to interpret it, or you just look at the HB and let it go?
No. You know, sometimes maybe someone have sickle cell problem, a B problem, and HIV. We just ask them to do everything. Maybe in case you have been treating the person, you ask them to go and do it, the full blood count, and come. So when they come, then you will select what you want.
Okay, so that's fine. So it means that we will have to look into it and know what it entails. Then you know, I mean, all the labs that you are requesting as part of this course, it is very imperative for you to know the basic labs that you have been requesting. So normally the basic labs that we request is okay. So what I'll do is that maybe in our next lecture, I'll look out for the basic labs, then I'll get some notes on it for us to look into it, so that at least you know what you are requesting, and when they come, you don't just pick and leave them to go with the rest. You should be able to interpret the result to your patient, and that makes the patient believe or trust you. You understand? But when they come and say, "Oh, everything is fine. Oh, this is okay," no. You're able to tell them that their platelet is low, their platelet is high, their neutrophils is low, neutrophils is high, the BBC is low, the BBC is high, lymphocytes are low, lymphocytes are high, HB is low, HB is high, MCV is low, MCV is high, and you should be able to know why. You understand? So that, I mean, you know what you are doing. Do you get what I'm saying? It makes you know what you are doing. Yes. I don't know if anybody has any other additions that you want to talk about regarding the full black and that I've said about. Any additions? So if there's no addition, then we are ending on the CSF. Now we look at synovial fluid. It's also one fluid. These are the non-common ones, so I'm treating them. We'll go to the common ones. We have what we call the synovial fluid. Where do we find this? Mostly at the joints. You understand? Mostly at our joints. We have the synovial fluids. And what they do? They are there to prevent what? To serve as what? As a cushion. To serve as a barrier to prevent this from rubbing against that. Do you understand? To prevent this from rubbing against this. Do you understand? So they are very, very important fluids in the body. Cerebrospinal fluid, you cannot do without it. Do you understand? You cannot do without cerebrospinal fluid in your body. You cannot do without synovial fluid in your body. So they become very imperative for us to know about. So we say synovial fluid, which is also known as the joint fluid, is originating from the cavities of the joint. That's the space between the bones. These ones. There are some cavities here. This one, there's a picture, so you will not see. Okay. So what do? Functions of they all transport, so mediation. So they transport nerve impulses. They transport nutrients. They transport how do you call it? Electrical chemical signals. So transport medium for nutritional substance such as glucose, also serving as lubricants. So synovial fluid usually requested by doctors in medical cases like joints or joint injury. So that one to look out for the what? The protein and the what? And the glucose levels. You understand? We look out for the protein and the glucose levels because it's just like that of the brain, that of the CSF, the CSF, cerebrospinal fluid. Typically, under fasting condition, the concentration of glucose in the synovial fluid should not be more than 0.55 millimole per liter, lower than the blood value level. So it should not be more than, they have their ranges. So maybe before I give you this slide, I'll try and put those things, you understand what I'm saying? I'll put the, like this, I mean this one. Something like this, like the liver. I'll put it there, like the request. Liver function. This is a kidney function test, sample of a kidney function test, and their ranges. This is that of a liver function test. So maybe I'll have to do that of the CNF, the CSF, and the, so that when you get a case like that, when somebody bring a report like that, you know what it means. Even if you are not going to interpret or give medicine for it, you know, you can explain to someone. That is also the reason for learning. Some of the things that we are talking about here, you are not going to use them, but you should know them. Because now you are a doctor. They will be calling you doctor. They bring something to you, you can't explain it. Then doctor, you are doing, somebody will say, you are not living to your task. So low value of synovial fluid suggests infection or joint inflammation due to glycolytic activities of what, bacteria or white cells. So when the glucose level is low, just like the brain, we realize that when the glucose level is low, we are saying that what, there is a bacterial infection that is feeding on the glucose. So same as here. Understand? When the glucose level is low, we are saying that what, there is what, a bacterial or white cell, how do you call it? Infection. Now, let's look at the protein. As proteins are large molecules, these molecules are not filtered through the synovial membrane. Normal synovial membrane protein is approximately 1/3 of blood plasma. So they have the normal one. So if you go and check and it's so high, it means that there has been a break in the what, in the barrier, and so larger molecules are entering. There's a hemorrhage. There's an accident. There is an inflammation that is taking place. You understand? That's the elevation of synovial protein value indicates patient might suffer from what? Hemorrhagic or inflammatory of the joint. You realize that I have deepened some areas. Okay, I'm deepening some areas. Maybe before I give the slide to you, I'll deepen most of the areas. So those that have deepened, take them very serious. Okay, there's no cause to worry. Just take those that have deepened them serious. I mean, if you are reading, just have a second look at them. Do you understand? Are you there? All right, that's fine. So we also look at lactate dehydrogenase as part of the synovial fluid. We also look at the. So I would do this one. Give me 1 second. Give me 1 second. Let's continue. I'll add it to the slide before I give the slide to you. Okay, I'll add it to the slide before I give the slide to you. We also look at the lactate dehydrogenase. It's usually like rheumatoid arthritis. When we talk lactate, it's more like an enzyme converting of lactic acid to lactate. When we start Krebs cycle, when we start glycolysis and Krebs cycle, that will be next semester. You know what we talk about lactate dehydrogenase. But then let me give you a synopsis of it. Now, what happened is that, do you know what we call muscle pull? Muscle pull. Do you know what we call muscle pull? Muscle pull before? Who knows how it happens? Who knows
Yes, please.
how does muscle pull, how does it come about? How does somebody get muscle pull? Anybody here to share with us? Evans, are you here? Mr. Evans, are you here? No, not,
Yes, I'm here.
No, not Evans Tepe. Not Evans Tepe. There's another Evans. Those those who were there were some 5 students who came to join. The direct student. The direct student. Is he here? Okay, how does muscle pull come about? Who can tell us?
Can I try?
Oh yeah, you can. Why not? You can.
Okay, so what I know is when there's deficiency in magnesium and some vital micro minerals within the system.
Okay, that's a good try. Any other person? How does muscle pull?
Sir, hello, can I try, sir?
Oh yeah, you can try.
Okay, it mostly happens as a result of overused part of the muscle. Thank you.
Okay, any other? Okay, let me ask this question. Who get muscle pull?
Hello, sir.
Yes.
This is Dr.
Footballers.
Footballers, that's right. So why do they get muscle pull? Madam Dorcas, let me hear you. You want to talk?
Because they do exercises. And sometimes I say because they overdo exercises.
It happens when the muscle is worked beyond its limit.
No, wait, please, Mr. Meshach, wait. There's someone on the floor. Madam Dorcas, Asana, let's hear you.
I was saying that the reason why the footballers always get muscle pull is because they overdo exercise.
Okay, that's fine. You are in line. You are on course. Any other? Mr. Meshach, you were talking. You wanted to say something.
Sir,
Mr.
I
Mesha,
was saying that when you overstretch the muscle beyond its
when you
limit
when you
or
over,
capacity.
when you overstretch the muscle, right?
Yes, please.
Okay. You're also in line. Any other person? Any other person?
Okay,
Okay, I think
I'm also thinking
I
that,
think
Yeah, you're
please,
online.
can I go ahead?
Yes, you can.
Yes, I'm also thinking that the muscle pull do happen because they really work out the body, and then the fluid that is to help lubricate the system and then allow things to work. I mean, there's what we call it, maybe we call it dehydration. They have been dehydrated. There's no much liquid, I mean, fluid in the system. That is to help
Okay,
that part
okay.
really work
I
as
get
it's supposed to be. That's what I'm thinking. Thank you.
I get you. Yes, Mr. Joseph. Let's hear from you.
yeah, sometimes lack of exercise also cause muscle pull.
Oh, really? Okay. That is your observation. All right. Any other? Are you done so that I come in?
Yes, I'd like to say something, please.
Yeah, Ingrid,
So,
let's hear you.
yes, so usually you do see it in athletes like footballers and sprinters, etc. And it is when the muscles are not used, they're overstretched. They're overused for what they're trying to do. So there's a range of, like, when all of the answers were on in line with what causes it. But basically it is when the muscles are stretched beyond what they're capable of doing at the moment.
All
So
right,
for
that's
instance, if at the moment you haven't worked your body in a way that it can take the speed that you're trying to do, then it will stretch, overstretch, or tear. So that's when it pulls, because so it stops you. That's my
all right.
take.
All right, that's fine. Mr. Samuel.
Okay, so I was coming to say the same thing Madam Ingrid said, like when the muscle is stretched beyond its limit, is what it's called muscle strain or muscle pull, if you can hear me.
All right, that's fine. Any other? Mr. Ahmed Voji.
Thank you. That can also cause muscle pulls. That is, it alters the neurotransmitters balance. So the imbalance of the neurotransmitters can also cause muscle pull. And also stress and anxiety can also do the same thing, also having to do with the neurotransmitters. Thank you.
Okay. Okay, that's fine. Any other? All right, so you are all right, but you were all close. Mr. Is it Donnet, Madam Donnet? Your hand up.
Yeah. What I want to ask, if what I want to know, find out, you may have said it already, but because I have to be come in and out at times, what causes the muscle cramps that you have in your legs and so forth? Is the same?
Are you asking a question?
Yes, I'm asking.
Yeah. What causes muscle cramps?
It's the same thing that causes the muscles to cramps as well.
And so what is that? What is that?
Muscle cramps to me is like when you probably stretch and the muscle is in a not relaxed, but in a state where it is impossible for you to get it back into the position that it was in a relaxed position.
Okay, that's fine. So you are all right. I mean, you are all close. So this is what causes I mean, the biochemical view of what causes muscle pull. So let's all listen attentively. Now you realize that during exercise, the body needs what? Oxygen. Okay? During exercise, you realize that whenever the athletes are running, you realize that their breathing is faster. Why is their breathing faster? Because they need to take in more oxygen and exhale. More oxygen and exhale. And inhale more and exhale. Inhale and exhale. And the body needs more oxygen. Because oxygen is needed to what? To produce the energy that they need to run. They need the energy that they are using to run. Oxygen is what? Is needed. When we start glycolysis and Krebs cycle, you appreciate it. So they need oxygen to what? To produce the energy that is needed for them to run. ATP production is a continuous something in the body. So oxygen is needed to produce, to undergo glycolysis, for Krebs cycle to continue, for ATP to produce. Continuous is in a cycle form. Now, what happened in muscle pull is that it gets to a point whereby there is a deprivation of what? Oxygen. You understand? It gets to a point whereby there is a deprivation. It gets to a point whereby there's a deprivation of oxygen in the what? In the muscle, the cells. So if you realize very well, normally those who go for this 100-meter race, the tight one, you see that it will strike the person sharp, very sharp, maybe in the middle or getting to the latter part of the what? Of the race. At that point, there is what? There is an anaerobic, there's a reduction in oxygen. So instead of the glycolysis to continue into Krebs cycle, it's converted pyruvate into what? Into lactate. So we'll get there. You appreciate it. But then I'm just giving you a synopsis. So it normally occurs when there's what? A reduction. I wanted to hear oxygen from any of you, but you are all talking about the muscles being stretched. Yeah, the muscles are stretched, but the muscles have elasticity. Muscles have elasticity. But you tend to feel that pain when there is what? A deprivation in oxygen, such that instead of the energy, instead of the body continue with from glycolysis to pyruvate to continue into Krebs cycle, it converts into lactate. And the lactate is being converted into a different thing by lactic dehydrogenase. So that is why in the synovial fluid we look out for lactic dehydrogenase. So if there is a raised, correct, when there's a state of hypoxia, let me put it that way. If you understand hypoxia, so that's it. Now you understand. So in a state of hypoxia, the pyruvate does not continue into what? Into Krebs cycle. So it is converted into what? To lactate. Now, lactate is being converted into other molecule to provide energy for the body. But then when there is continuous occurrence of lactate, or when there's a continuous level of hypoxia, there's going to be high level of what? Lactate in the body, and that will form what we call lactic acidosis. So that lactic acidosis is what is producing the pain the person is feeling. So when there's lactic acidosis in the cells, that is what brings about in the muscles, the cells of the muscle. That is what brings about that pain. Okay, so this is an assignment for you. I'll ask you on the next class. Okay, how does muscle pull occur? Okay, how does muscle pull occur? Process that by which muscle pull occur. So when we start learning about glycolysis and Krebs cycle, you understand it, okay? But then this is just how it occurs. So there is a state of hypoxia. When the person is running, there's a shortage in oxygen. So because of the shortage in oxygen, there is a chemical reaction that is taking place. So it gets to a point where, because there is no oxygen, there is no conversion of what? Pyruvate into what? To enter the Krebs cycle. So the lactic pyruvate is converted to lactic. If lactic occurs severally, or if the hypoxia state occurs continuously, if the person continues to have, because it gets to a point where the breathing of the athletes, they need a lot of oxygen. Their oxygen level goes down, but they will still be running. So that is a point where muscle pull comes in. So some of us, the muscle pull I'm talking about, some of us were mistaking it for numbness. Because some was saying stress, some were saying lack of sleep, and those one. The one you have been feeling, anansi, we call it anansi. That is not muscle pull. We have muscle pull correct itself, one that will strike you down. That is what I'm talking about. But sometimes we can get some minor muscle pull. That one is mainly your. Sometimes when we have a sitting position for a very long time, it impairs blood flow. If blood flow is impaired, oxygen is impaired over there, and so that one too can cause some muscle pull over there. But then that of the athlete one, it is mainly because of what? Hypoxia. Mr. Major, Amevoji, is your hand up? Do we understand now? Do you understand now?
So hello, Doc.
Yeah.
So please, the hypoxia, that means deprivation of oxygen in any part of the body.
Yeah. No.
Oh,
yes.
okay.
In the cells. I mean, they are. You see, when
Cells.
they are running, when you are running, the oxygen level goes down because they need the oxygen. Because that 100-meter race, it's not a small race. Oh. Some people go within 9. I think Usain Bolt use what 9 seconds or so. Yes. 9 seconds.
Okay.
8. Some are using 8 point something seconds, 10 seconds. So if you are to run this race, so definitely some of them they run short of oxygen. That is why it is very despondent that most athletes they go to higher altitudes, like place that there is higher altitude. When you run, that's why the Jamaicans and the Kenyans they are able to run very well down here. 9.5 is okay, that's fine. That's why the Jamaicans, the Kenya, those who have higher altitudes where the sun is so scorching very high, over there the oxygen level is low. So if they're able to run very over there, when they come to the southern part or when they come to a lower altitude, where the southern part where there's lower altitude, and I mean they're able to run, they're able to gather enough oxygen and run faster. You understand?
Doc, I want to know, does it only happen in running or it can just happen in any part of the body?
Oh, mostly it happens in athletes because it's a state of what? Hypoxia. So if there's any state of hypoxia, yes. You understand? Sometimes you got somebody who's asking me, what about heart attack? Heart attack is different. Heart attack can be a blockage of blood vessel. That one is different. That one is not. That one is different. But
So, sir, is it? Hello, sir.
Mr.
Is
Peter,
it what will cause that? Is it the water shortage for the person doesn't drink water consistent? That.
oh no, you see at that point when they are running that race, mostly they drink. It is a state of lack of oxygen. It's not about water. Fine, water is there. Maybe they are losing water. They are dehydrated, all right. But then the oxygen level that they're able to inhale, it gets to a point where it's low. Have you run before? Why do you think that when we are running we stop? You see that you are panting. Why? Your oxygen is going down. Or you don't realize it. Who has ever run before, like gone for a race before? If you are running, you run a short while. Even some people when they are walking, they are tired. The oxygen is low, so they have to wait. You understand? That is even walking. You understand? So lactic muscle pull comes as a result of a state of what? Hypoxia, reduction in oxygen. No worry, we'll get there. I was just giving you a synopsis of that. I mean, I was just giving this is just a curtain blazer, okay?
Hello, sir.
Yeah, anybody want to talk?
Yes, sir.
All right, let's have you.
Yeah, please mind deals with we are saying that when there's a shortage of oxygen, that's one of the contributing factors that leads to re-developing the muscle pull. And we are saying that the oxygen is also a saturation through the blood and every part of the body. So why it that section, the muscle itself, and mostly I know the muscle pull mostly happen with the thigh area to the left side. Why that section mostly occur?
Why does it really occur at that session?
Yeah, exactly.
Oh no, because the reason being is that you see the body is such that whenever at every point in time there's one part of the body that is in active use. So at that point, it is the muscle, it is a thigh that is in active use. So enough oxygen has to go to the thigh muscles. They will need enough oxygen to undergo how do you call it? Metabolism, to undergo glycolysis and all those ones. And generally, the how do you call it? The hypoxia occurs in the body, but just that they tend to feel it in the muscle because it is a muscle that is moving a lot. You realize that if you are running, the majority part that is doing the work is the muscle. Or is not the thigh muscle that is doing the work?
Yeah, that's the case.
Yes, it is.
Where the work is done. That is where the work is being done. So that is how come they get the muscle pull. So it's basically mainly because of the fact that there is what you will get to know about it. So let's continue. When we get there, we'll treat it. So it's part of your this thing. If you want me to treat it now for you I can treat it now for you. So that when we get there, we'll just rush and continue. But let's continue. So that is it. So we look out for what? Lactate dehydrogenase. So usually raised in conditions like what? Rheumatoid arthritis. Then you look out for uric acid 2. So uric acid 2 in the synovial fluid, excess of that can cause a condition we call gouty arthritis. It's even part of the presentations I gave you. Yeah, there's a group who is working on gouty arthritis, gout. So synovial fluid uric acid is performed to verify the diagnosis of gout, apart from the results obtained from the serum uric acid test. So yes, we do the serum uric acid test, but we also do the synovial fluid aspirate. They aspirate some content of the synovial fluid to do the what? To check for uric acid levels, to check for a condition we call gouty arthritis. Because it's a presentation for some group, I would leave it there. I wouldn't talk much about it. When they are ready, they will discuss more about it. Thank you. Any question? Is there any question? I think we can continue, right? Now we look at peritoneal fluid, ascites. We are looking at the fluids in the body. We are looking at fluids in the body. Fluids that we can take sample to go and run labs. So we have looked at the cerebrospinal fluid for the brain and the spinal cord. We have looked at the synovial fluid for what? For our joints. Because as part of your course, people will be coming with joint problems. You'll be coming with those problems. Don't they come?
They are really, they come.
Yeah, they'll be coming with them.
They come.
Yeah, so you need to know, at least you need to do a synovial fluid aspirate test to see, at least to check those things, even though it's not a common thing that we do. But if the patient comes continuously, you would want to see what is happening at the synovial joints. You understand? And now everything is online. Okay, so you can type synovial fluid and you type the what? Interpretation. When you type maybe synovial fluid test and interpretation, Google will give you, or AI will give you all the interpretation. Then you read. Then you also know that, oh, okay, this is what it means. This means that this means that this. If I'm bringing everything here, our class will be a very long class. That's why sometimes I have to show you pictures of it. Just get the ideas of it, and we also move on. Now we're looking at what? This one. We are looking at what do you call it? Peritoneal fluid or ascitic fluid. Now, when we talk about ascitic fluid, we are saying that there are in some situations or some conditions whereby a patient's stomach or belly, a patient's abdomen becomes enlarged, okay, enlarged, and it's full of what? Fluid. So we call it what? Peritoneal fluid. Now, we'll ask ourselves, how does this fluid form? It can be that there is what? There is an imbalance. You realize that normally, uh, when we talk about edema, when we say edema, do you know edema? Edema of the feet, edema of the feet. Do you know edema?
Yes,
Yes,
please.
Yes,
sir.
sir.
Yes, edema. Do you know how edemas are formed? How does edema form? Do you know how edemas are formed? Today, there we are. I'm quizzing you a bit. Do you know how edemas are formed? Let's have the ideas. Yes. How does edema form?
But let me give it a try.
Oh, you can try, my brother. You can try. We are all trying.
Thank you. From
Yeah.
my personal view, edema is formed when the body retains much food than it can excrete, or much food is accommodated in the body due to the malfunctioning of the kidney. Thank you.
Okay. That is your idea. That is yours. Any other person? How does edema form? Edema.
Please, can I give it
Yes.
a try?
Oh, give a try, my brother. Give a try. Give a try.
This is a sister. Okay, so when there's excess
Oh, okay,
fluid,
Madam
when
Christiana. Sorry,
excess,
man. Yeah.
yes, when excess fluid leaks from capillaries into the tissue, the surrounding tissues, that's when edema can be formed.
Let's give it up for her. Let's give it up for her. Let's give it up for her. 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 Many times. Yeah, I want the manual. Give it up. That's a manual one. Yeah, Mr. Henry, let's hear that. Let's hear you.
Yes, I think when there is a lymphatic blockage also, the lymph nodes or vein fluid properly, it also results in that
Oh,
or
my
infection
good.
or cancer.
My good. Give him a manual one. Give him a
So
manual one.
adds
A
to that.
manual one. A manual, give it up. A manual, give it up. Yeah, 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 yeah. So that is how come edemas are formed. And normally, let me go a bit science. You are saying that yes, when there's a lymphatic blockage, it can cause that one is lymphangitis. That one is enlargement as a result of a lymphatic blockage. It makes you have edema of the feet. Now, when we talk about the fluid one, the one Madam Christina talked about, the capillary, yes. Normally, we have two pressures, we have two forces. We have the hydrostatic force and the oncotic force. The hydrostatic pressure and the oncotic pressure. Now, what happens is that hydrostatic pressure keeps fluid inside the what? Inside the intracellular space. Oncotic pressure makes fluid go outside the extracellular space. Sorry, the other way around. The oncotic pressure keeps fluid inside the extracellular space, and the hydrostatic keeps fluid outside the extracellular space. So when the hydrostatic pressure goes beyond the oncotic pressure, you realize that fluid will move outside from the intracellular to the extracellular space. So you look at these two legs, you realize that the right one is what? Edematous. That one is fine. Look at these feet. And it also happens in what? In pregnant women. It also happens in what? In pregnant women. So let's read. So swelling is that what? Edema is swelling of from excess fluid trapped in the body tissues. Common in feet, ankles, legs, but can occur anywhere, often appearing as puffy, heavy, tight, with lengths, with skin dimple. dimpling, pitting after what? Pressure. So we say pitting edema. Pitting edema. Pitting, that is the medical term. If you press and it dips, we say it's what? It's a pitting. Causes range from mild issues like too much salt, standing too long, or pregnancy. So serious conditions like heart, kidney, liver disease, and medications. Treatment focus on the cause and includes leg elevation, compression stockings, low salt diet, and sometimes diuretics. But seeing a doctor for diagnosis and management is the what? Is the goal treatment. So that is edema for you. So now we are saying that how edema forms. Okay, high BP medications. Yeah, some BP medications also give edema of the feet. Yeah, that's true. That's true. That's right. I'm sure this is from an experience, right? Yeah. So.
Yes.
So what about
Yes,
injury?
What about what?
Injury, for example, twisting of the leg also can
Yeah.
lead to that.
It can cause that. Cellulitis of the leg can cause edema of the feet. So when there's a twisting, there's actually a trauma to the leg, right? When there's a trauma, it can cause what? Swelling. And as part of the swelling, this swelling is going to be as a result of what? Inflammation. And so there's going to be edema of the feet. Yeah. So that's right. You're right. Yeah. So
what about reduced plasma proteins? What about that? Reduced plasma proteins.
It's true. The reason why the oncotic pressure is lower than the hydrostatic pressure is that albumin is also low. And protein, we get albumin from what? Protein. So it's true. So you're right. I mean, we have not delved deep into it. If we are delving deep into edemas, and the
Oh, please, I can't hear anything.
Hello.
Hello, yeah.
Can
Yes,
you hear
sir.
me?
We are here. Yeah, I can hear you.
Yeah. My network, I think my bundle got finished, so I had to swap it. So sorry about that. Yeah. So let's continue. So that is with edema. So do you understand now? Do you understand how edemas are formed now? So it's a result of what? Pressure gradient between the what? Between the intracellular and the extracellular space. You understand? So it is, and everything I'm talking about, anything that you see in the body, let's always look at the cellular level, because that is the basic unit of life. Everything occurs at the cellular level. So whatever we are talking about, human being, anything we are talking about, take your mind to the last word, basic unit of life, which is the cell. So everything occurs at the cellular level. So for you to see someone's feet like this, you can imagine the number of cells that are in play. Do you understand? Someone can get edema to the level of the knee. Yes, we have edema. We have conditions like what? Like heart failure. So you see this one. This is what? Bipitting edema. This is a classical case of what? Of either kidney, liver, how do you call it? Liver disease, kidney disease. It can even be a hepatorenal syndrome. It can be a heart failure. bipedal edemas. Look at them. You see that? These are what? Classical pictures of what? Of an edema. So normally, when you want to palpate for edemas, we call something. Mr. Joseph, please mute your microphone. You're making some noise. Ingrid, you want to talk?
Yes, I wanted to ask a question, please.
All right, let's have.
Yes, one of the common that I'm aware of anyway. One of the common, call it side effects of taking high blood pressure tablets is swelling of the feet. And usually the doctor then gives you another medication to release the fluid from the feet. But it is a known thing that when you're on high blood pressure tablets, what comes next is swelling of the feet. So what is it in the medication that causes what causes the swelling of the feet, the fluid retention? Because then they give you these diuretic medications to release the fluid. Thank you.
Okay, that's a very nice one. I mean, yes, some do, but not all of them. Some of them, their side effects. I think there's one, not them.
Oh, okay, okay.
There's one that gives swelling of the feet and those ones, but those ones, they are just minimal. Not for, it's not even every patient. Some people they can be on that same drug and they will never get it. So the side effect does not run through everyone, and even it's not all the drugs. And also, the reason being also is that sometimes it is not even the drug. The patient's condition has changed from one condition to another. Some people have hypertension, and in the end, getting to the latter part, I mean the later stages of their condition, they tend to have heart failure. You understand? So when there's heart failure, there's going to be bipedal edema. We will treat heart failure in medicine, and you appreciate it. Okay.
Okay, thank you.
Yeah, we will treat heart failure in medicine. When we are treating heart failure, you are going to appreciate what we are talking about here. You begin to know why there is what the fluid build up over here in heart failure. So in
Okay.
heart failure, it's not about capillary, oncotic, and hydrostatic pressure. No, heart failure is a different thing. But then we are saying that this person, there are some cases the person does not have any heart condition at all, pregnant women. But then there is what? There is this one. There is edema. Sometimes there is what? Poor venous return. Because of what? Positioning, pressure. For instance, in pregnant women. In pregnant women, this is as a result of what? Poor venous return. Because of the intra-abdominal pressure is pressing against some of the what? Of the bigger vessels. And so the venous return is not so good. You understand? If I say venous return, the veins, the veins carry blood back to the heart. I think I've taught you the heart last time. Please, next class, you are going to explain what I told you the last time. So please don't forget about the heart. If I mention your name, you are giving it to us. Yes, and we are awarding marks for that. Because we are not joking at all. You can't learn and you forget to. I beg you. That's why I've asked you to record. Yeah. Mr. Henry, you want to talk?
Yes, Doc. I just want to find out from you and from the class that edema, is it a disease?
Oh no. So edema on itself is not a disease. A disease brings that. We can have one. We can have it coming as a result of a disease or as a result of a state of health or a state of life. So, like I've told you, even edema can come as a result of what? Long hours of sitting in a car. You understand? So, it can be as a result of what? One, when there's poor venous return. It can be two, when there is what? A state of health, like liver disease, kidney disease, edema can occur. Heart failure, edema can occur. Medication, edema can occur. So you can't attribute edema to one like it's a disease. No. If you see that somebody's feet are swollen, you just can't conclude that, hey, this person there, he's diseased. Is there any other question? I want us to continue. Ingrid, what's your question? Madam Ingrid.
It was just a comment to give an example for the lady that asked the question just now. When you're on long flights or
Yeah,
long train rides, like 18-hour flights, the air hostesses make sure that you get up and walk around to
yeah,
release
yeah,
the fluid because it can be dangerous. I've had that experience with my mother,
yeah,
and we had to miss a flight. She couldn't travel for weeks because of it, leaving from Ghana to go back home. And
yeah,
because
yeah,
of what happened, I'm just saying that it's not a disease. I'm just
yeah,
buttressing what you're saying. It's something that can occur in even a normally healthy person. Thank you.
yeah, yeah. That's a very nice one. That's a very nice one. So you do understand now. So it's a particular state.
Yeah.
It's not really it's not a disease.
So can we
Let's
then say that?
yeah,
So we can. So can we then say that it's a symptoms pointing to an underlying issue?
yes, it can
Can we
be. That's
then
what
say
I'm
that
saying.
it's a
That
symptom
yes, it's a symptom
pointing to
point to
an? Okay.
underlining state.
Thank you.
Who's this one? Is that? Yeah, so
Okay. Thank
edema
you,
is
sir.
just a symptom of, it can be a symptom of a condition, a state of health. I mean, it can just be a trance. It can just, it's something that came to pass through. It's a result of positioning. Yes, so let's continue. So that is peritoneal fluid. So we say that what? So this fluid, one is caused as a result of what? How edema occurs. That is why I had to go and take you through edema. So I made you know that when there is what? An imbalance in the pressures in the what? In the blood vessel, where hydrostatic pressure overcomes oncotic pressure, and fluid is seeping into what? Into the what? Into the bloodstream. So over here too, this is what is occurring. That when there's an imbalance, when there's a condition whereby there's an imbalance, there can be a seep of fluid into the what? Peritoneal cavity. That is one. Then the second one is when there is what? An inflammation. When there's an inflammation of any of the tissues or anything, then just like you have had a sore on your leg and it's discharging, it will be discharging into the peritoneal cavity. Do you understand what I'm saying? So we have what we call a transudate and an exudate. So when we say transudate, transudate is what? Using the edema analogy. When there's an imbalance in the what? In the pressures that regulates fluid from inside and outside of the cell. One. And when there's an inflammation of what? Of any of the what? Organs in the what? In the abdomen, which is causing them to what? To exudate, to discharge. So the discharge is what? Is filling the peritoneum and is causing it to what? To bloat up. Do you understand? If you understand, let me see the thumbs up. Yeah, that's fine. So peritoneal fluid is fluid that is located inside the abdominal cavity. So I've explained, I'm reading. Functions of peritoneal fluid are to support the abdominal organs and reduce friction caused by. So if you see someone's belly like this, it is two things. Either it's a transudate or what? An exudate. Do you understand? So abnormality occurs when the peritoneal fluid accumulates inside the abdominal cavity, which causes ascites the abdominal fluid. The accumulation of fluid is usually happening due to two main causes. So what I said, two main causes. Either there's what? A transudate, an imbalanced pressure within the blood vessels due to what? Conditions like liver disease. So liver disease is due to what? An imbalance in what? In pressure in the blood vessels. Causes liver disease. Do you understand? It's a whole lot. It involves a whole lot. If you are taking the pathophysiology, it's a whole lot. But all we just need to know that liver disease is caused as a result of what? Imbalance in the blood vessels. Like the way edemas are formed. That is how come. So it's just like an edema in the what? Occurring in the abdomen. In the abdominal cavity. Do you understand? So if this fluid is occurring, this fluid is not in the blood vessel. It is pouring in the what? In the abdominal cavity. So over here, we normally, what do? We normally do a procedure. Mr. Kumsin, we normally do a procedure we call abdominal paracentesis. Abdominal paracentesis. I think I've mentioned this already. I showed you a picture the last time, right? Hello? Hello?
So, dog, we are listening. We are listening.
Abdominal paracentesis. I think I showed you a picture.
We are doing now.
I showed you a picture the last time, right?
Yes, sir. Yes, sir.
So this is it. So you see, so this one like this, there's nothing like giving the person medicine to drain the fluid. The person will drink it. The medicine will go through the bloodstream, all right. Maybe it will help, the medicine can help to reduce the pressure, but the one inside is in the bloodstream. There is no way the medicine you take, even if it will take a very long time. But these people, what happens is that because of the imbalance, their fluid keep on building up. So that is why we do what? We do the tapping to reduce the what? To reduce the fluid so that they can breathe. Because when the fluid is too much over here, they are not able to breathe. The diaphragm is not able to contract and relax. The diaphragm cannot contract and relax. Let me show you the diaphragm. So this is the diaphragm. This is the diaphragm. You see the curvature nature over here. So when the fluid is too much, so when the fluid is too much, you see the diaphragm. You see how the diaphragm is. It presses against the diaphragm. I think the diaphragm during inhalation, the diaphragm goes in. Exhalation, during inhalation, the diaphragm is what? Relaxes, and inhalation is what? It bulges up. It contracts and relaxes so that breathing can occur. Now, what happens is that the reason why we have to do the tapping for them is that the fluid presses against the diaphragm. This fluid goes to press against the diaphragm. Oh, I want to see a classical one. So you see this one. The fluid there is putting pressure on the diaphragm. So the diaphragm cannot expand and relax. So these people will come in what? In respiratory distress. There was one man that I had to do the tapping for. They come and will do for them. We come and will do for them. So maybe they will die. Most of them at the point they don't see it up. They don't, succeed. Look at this abdomen. You see how tense it is. You see how tense it is. So that the veins are the veins are all showing around. The veins of the stomach muscle are even showing around. Are even all showing up. So that's what we do. We do what? Abdominal tapping. So this one, like this, sometimes what worries us a lot is that now you guys are coming to know, so you not do that. Is that patient like this, you should know that this patient needs tapping. That's what I'm teaching you, so that you not make this patient put this patient on long-term medications. But some of these patients, they even have liver problems and kidney problems. You understand? And so you know that some of our herbal medications too, you have to take them when your, if you should rest assured of, your kidneys and liver should be good to be able to detoxify and to clear them from your body, because the drug will work itself, but then your kidneys should also be able to work to what? To detoxify them, and also and your liver should be able to your liver should detoxify, the kidney should be able to excrete most of them. You understand? So you should, if you are giving it to patients, should patients who have how do you call it? Who are, I mean, healthy in terms of their organs. But then sometimes, mostly, even at the herbal, even at the prayer centers, I don't know if any of us have prayer centers. They keep them there. They'll go and lie there when the patient is running short of oxygen. You see that this abdomen is tensed up, pressing against the diaphragm. The patient cannot even breathe, and they attribute it to witchcrafty to you'll be able to be a kind of self. So we'll be able to draw. I mean, I want to speak English so that our Jamaican people will understand. Somebody has uh, it's not poison. I mean, we'll be able to draw. How do we say it in English?
Okay.
Yeah, the what?
Pronounce cursed on the person.
Okay, cursed. Okay, cursed. Okay, whatever. Let's say cursed. Cursed. Okay, let's put it that way. Curse is a diabo. Is it the same thing? Well,
Yeah,
anyways.
yes, sir. Yes, sir. Is it attack,
Okay,
spiritual attack?
let's make it that way. Spiritual attack. Some people they even try them. They'll tell you they try you. That is our people, our people.
It is
They tell you that
sorcery. Sorcery.
sorcery.
Sorcery dey ebe you.
Okay. Yeah. I mean, you all understand, right? You all understand, right?
Yes,
Even
sir.
Ingrid
Yes.
understand. Ingrid understand. Then let's continue.
Yeah. Yes, sir. We do.
Yeah. So that is how we attribute it to. But you realize that maybe there's a problem. There's a liver problem. And as a result of the liver problem, I'm teaching you for you to understand so that you will not be like them. You know that there is an imbalance in what? In the intracellular and the extracellular space or vessels that is causing a seeping, like edema is being formed into the peritoneal cavity. So it's fluid that is occurring there. So if you are giving your naturopathic drugs, you are focusing on helping to maintain the balance of the what? Of the oncotic and the hydrostatic.
I can't hear you.
Can I hear something?
Let's wait. The electric line drop, so we are all waiting. Okay.
Hello?
Hi.
Okay, okay. Just testing.